Hi, good morning, everybody. Thank you very much for joining us. How nice we can get together again, talk about kidney issue, how to keep your kidney healthy. There is a real reason why. Actually, I want to give this lecture to everybody. Make sure you guys have, get that information. The reason is because during the last meeting with Professor Larry Chan, a lot of people come back and say, Andrew, can you decode that a little better, make it easier so I can understand how do you actually get better information how to protect my kidney. Because actually kidney is a true silent disease. And there's a lot of people really didn't know their kidney disease until they got to be very severe problem. And that is really sad because I can tell you there's a patient of mine, as I said, Mrs. Wong, which was a 53 years old diabetic earlier. And then until 65, suddenly it's realized, wow, my kidney is not functioning anymore. And so then after that, they got panic and said, I better do something about it. And but on the hand, at the end of the day, everything comes down to is only get down to limit at 40% of the kidney. Now at 30%, most likely she needs dialysis. So net result, we were able to prevent this occurrence. So that is really super that she now, the kidney really function at 40%. But if she continued to be in this stage, maybe she lived most of her life at 40, basically at most of her life, basically at 40% kidney function. So at least it worked. It didn't need to be dialysis. At least she have a good life, and she now become much healthier because her blood sugar had went down from early was 10 high and now around 7 and lower, 6 point something, but it's not that quite all the way 6.4 yet, but it's still in there between 6.5 to 7. At least it's much better. Hopefully she will continue to drive this down to 6.4 and below. That would be excellent. So this is where I guess the benefit of us having those lectures help her to better understand what's happening. And so I was very happy now today. I saw people from Los Angeles, people from Hawaii, people from Philippines, people from Vancouver and Canada, Hong Kong, talk about what is really truly kidney disease all about. So, it's wonderful. At least people are interested, and a lot of Hong Kong people did actually come back to ask me, hey, can you, give me that information so I can decode, make it easier for me to understand. Now, Eugene, can you tell me, did you get your Facebook? Also, can you get your, now you get your Facebook? Okay, you got both Facebook 1 and 2 is all there. Okay, good. So you guys can see me in both Facebook and also in, Zoom. That would be perfect. All right, so now we're going to start our webinar. 各位朋友，多謝各位你今日百忙嘅時間都 spend 啲時間同我哋一齊傾傾乜嘢叫健康嘅腎咧？因為如果我哋個係糖友或前期患病者糖友，點能夠令到我腎繼續健康咧？咁呢個咧係一個好嘅 subject 嚟嘅。點解咧？因為我有個病人啦，咁佢係53歲嘅時候已經係糖尿患病者，但係佢冇乜點理啊。到現在咧，佢60幾歲啦，咁佢先知道原來我個kidney 咧只係得翻40%，嗱低過40至到30咧，佢就要洗腎嘅。咁相比嚟講，我哋係其實救咗佢一個所謂好難嘅問題出咗現咧，就係如果佢真係繼續唔理咧，佢就去到30咧，佢就 end up 去做洗腎。咁佢好開心，佢話多謝 Andrew 真係好幫助。咁最後咧，其實咧，佢依家可能 live rest of the life 喺一世下咧，佢都係喺得翻40% 嘅腎嘅功能，但係 OK， 佢最多唔使洗腎啦，佢可能保持身體健康啦，佢依家飲緊血糖茶啦，降低血糖咧，由10嘅上面咧，依家掉落係 between 6至7之間，咁啊好鬼正。咁我都好多謝咧，佢能夠咁努力自己去搞呢樣嘢 ，OK。 So it's so wonderful that we can see patients actually reacted to our lecture and they really start acting on it. I think that's the most important. You need to act on it. If you act on it, you become a better person, and that result of that, you really become a better health. So I'm going to share my screen now and make sure that we got that. So today our topic is actually, if you are pre-diabetic or diabetic, and many of them are, including myself, how do you keep your kidney being healthy? And that's the whole topic today. And that is so important. I think it's so wonderful. People from Hawaii, Los Angeles, and all that start saying that, wow, I better learn a little more. If I can learn a little more of that, I can prevent myself to get ourselves in a bad situation with a bad kidney disease. So I'm grateful to able to have that opportunity to share with you the findings and the know-how. That result that you can able to actually keep your kidney healthy. So I'm just going to take 5 minutes just to go through real quick because we have a lot of new people comes in. So make sure they heard about why you become a diabetes or pre-diabetic. Remember, diabetic, you never get well. It's only a chronic disease. You only can able to control, not cure, control. So the sad part of diabetes is affect your entire body. All the blood vessels become clogged because this plaque clotting all over the world, over the whole of the body, including your brains, your heart, your kidney, everywhere. So that's why it's so damaging. And once you damage a certain point, it doesn't reverse. It was always there. So diabetic is a lifelong disease. You got to control. And how do you control? You have to control your blood sugar. And that's why if you control your blood sugar, your serious diabetic complication, most likely the risk will be subside. You have to continue to get your A1C to be continue to drop down to below 6.4. Because if you don't get A1C go down to 6.4, you're going to have issues. And pre-diabetic is the same thing. You have to continue to lower your blood sugar to prevent to convert to be a diabetes, and hope that you don't ever convert to diabetes. If you can continue to maintain below 6.4, then you don't have no medication, no other problem that we have to attend to. It will not affect you all the part of the body. So the question you might ask is, well, how do I control? The very important, you have to control diet, exercise, weight management, and also track your blood sugar, because that's the only way you can tell. But picking a finger and instead of drinking Lowsutea will help, because that will lower your blood sugar, cholesterol, detox, and eventually lower also your blood pressure. And remember, white powder food, meaning white bread, sugar drinks like soda water, Coke, all that has to be eliminated. Now, everybody, no matter who you are, you will go through 4 stages of diabetes. The first stage is when you have high cholesterol, which is the LDL cholesterol. This is the bad cholesterol going up. And it start damaging the B cells, which is the cells come out from the pancreas. The B cells are supposed to take the sugar into the cells. And this insulin with the B cells, with the cholesterol going up, it starts damaging the B cells. So the pancreas will keep coming more B cells, it doesn't work. Eventually you get more and more so-called insulin resistance. When that happens, your blood sugar continue goes up, your cholesterol continue goes up. Then the second stage that comes in is when your body starts forming clots everywhere because the blood becomes thick and forming plaque everywhere. This is where your key problem is going to come. For years, you're forming this plaque, you'll get your blood pressure go up. You're also going to get your body, clot everywhere. If you continue to plaque that, eventually vessel damage, nerve damage, all that will come, and it cannot be reversed. Now the stage 3 will come is when your blood sugar keep going up from 5.7, the A1C. A1C is the hemoglobin, the sugar amount, a percentage sugar attached to these hemoglobin cells. It could be 5.7 first, because below 5.7, you're a normal person. Keep going up to 6.4, you are pre-diabetic range. And you continue goes up beyond 6.4, the stage 4, you are diabetes. Everybody goes through that. So that's why every doctor will measure pre-diabetic and diabetes, your A1C. The hemoglobin A1C will tell the story, average figure every 3 months, what happened to your blood sugar, okay? Now, why I suggest to drink Lowsutea is because Lowsutea has 2 items in there only. One is guava leaves. Guava leaf will delay the absorption of blood sugar into the gut vessels, so less sugar into the vessels. Secondly, bitter melon will give you act like a insulin. The reason why I say that is because the bitter melon is actually increase the sensitivity of the insulin, and it gives you more sensitivity, so they will get back the sugar into the cells. And the additional excess of the sugar, it will actually dump the sugar out through urine. It don't reabsorb. And also, it will dump out the cholesterol out the urine also. And so with that, you detox. One more thing to dump out is salt. So net result, you will also eventually, your blood pressure will come down. So you drink Lowsutea will give you 3 low high, because the 3 high go up, it will bring it down. A lot of people now drink Lowsutea, they say, hey, my swell went down. Give you one good example. One of my high school administrators was telling me that after I drink Lowsutea, immediate feeling is the blood feeling much better. Secondly, he saw the swell of his leg also went down. And he said, wow, this is really good. I never had that before. So this is the kind of comment that we found from people drinking Lowsutea. Now, if you don't do anything, you know what's going to happen? You're going to have problems like eventually you get possibility of stroke, eye with glaucoma, pancreas malfunction, heart disease, which is blocking your heart. You have heart attack, you have nerve damage, high blood pressure, you have damaging of blood vessels, because all the blood vessels are clogged, and healing of because the clogged blood vessels, the circulation poor in the lower extremity, the end of chop of your foot. The worst is your kidney will be damaged, because nephropathy is going to be very common. Actually, 1 out of 3 diabetes people will have kidney disease. Imagine that as a high number. Plus, because you don't feel you have no sexual function. So, plus people with gestation diabetic will be the same thing. They become a diabetic. So this is really a disease. It will be very, very long-term problem if you don't take care of. Okay, so it's good that you guys are attention. You guys are now pay attention to it and want to do something about it. And that is so motivating. Okay. 各位堂友，講多一次咧，就係點解每個糖尿病者咧都有4個 stage 咧係become糖尿病嘅。第一，佢就係有首先個胰島素出啲糖嘅胰島素咧，你出啲糖嘅insulin 咧，佢裏面有個叫做 B cell。嗰胰島素嘅 B cell 咧係帶啲糖入去個細胞裏邊嘅，但係當你個膽固醇 LDL 上升嘅時候咧，就 damage 咗嗰啲 B cell， 就唔帶啲糖入去咯。咁越出多啲胰島素出嚟咧都唔 work 嘅，咁呢個就變咗呢個 insulin 嘅 resistant， 即係有呢個胰島素抗拒。咁抗拒之後咧，啲糖又上升 ，cholesterol 又喺度高，咁你個第二個 stage 就出現㗎啦，因為咧啲血同埋啲 LDL cholesterol 咧就令到血好結。咁就 form 好多 plaque， throughout the body， 哇，好弊喎，全部都好多 plaque。咁變咗嚟講咧，要去你腦啦、心臟啦、kidney 啊，邊度都有嘅。咁但係如果你繼續唔理咧，你糖亦都繼續高 up 啦。嗱，你個血壓已經上去啦，你個 cholesterol 上去啦。咁你第三個 stage 咧，你糖可以上去啦。舊陣時咧，你個糖咧就有個細胞叫做紅血球，叫做紅血球。呢個紅血球咧叫hemoglobin， 呢個紅血球 hemoglobin 就係有啲幾多個 percent 嘅糖黐入去嘅。如果你 under 5.7%， 你係普通人 OK 嘅。但係如果你係多過 5.7 咧，咁你開始叫前期患病。去到 6.4 咧，都係叫做前期患病。但係你咩驚唔理啦，繼續等佢上升咧，去 6.4 以上 6.5 咧，3年之後多數啊，咁你變咗糖尿患病者啦。咁每一個人都go through the same thing 嘅。咁其實咧，去糖茶點 work 咧就好簡單，有兩種嘢。第一個就係叫 guava leaf。咁 guava leaf 就 delay 咗嗰個absorption 啊，即係嗰個糖嘅吸收入去個大腸嘅血管裏邊。第二樣有苦瓜，苦瓜就帶翻啲糖，其實佢就係將個胰島素咧個敏感度增加咗去，增上咗去。咁啲糖咧喺胰島素就帶翻入去個細胞裏邊啦。咁仲有咧，如果啲糖太高咧，佢亦都由尿道咧掉咗出嚟，掉埋啲 cholesterol 出嚟，又掉埋同你排毒，再做一樣掉埋鹽啊。當你掉啲咁樣咧，你嘅血壓就會降低。所以三高。飲咗胰島素飲咗呢個去糖茶咧，就會降低你三高嘅，同埋仲有幫助你排毒啦，因為掉晒啲垃圾出嚟啊嘛。如果你唔係去處理呢個病咧，你就好有弊家伙啦。因為幾年後咧 ，guess what？ 你第一有中風嘅風險啦，有青光眼風險啦。有 pancreas 嘅malfunction 啦，即係你個胰島素嘅問題出現啦，仲有咧心臟病或者你個腎會衰退，或者血管會損壞，仲有血管流通唔到咧，腳都會斬埋，哇！真係好慘啦。所以呢個咧係一個長遠病，你一定要 take care 嘅。咁我哋公司咧特別係一樣嘢咧，我有5個 program， 有 diet 啦、exercise 啦、weight control 啦，我哋每個禮拜都有講書啦。同埋咧有 daily 嘅blood tracking， 點樣教 blood tracking 咧？去幫助你降低血糖。我哋希望咧做晒啲嘢之後咧，你血糖咧會跌翻去 under 咧6.4下，去做咧去嘅5.7。我見過好多個病人已經有5.7。So you know we have 5 program. Our 5 program objective is to help you hopefully provide you all the lectures, all the information, giving you know, the program to lower diet, like Lowsutea will help you to lower your blood sugar, cholesterol, and blood pressure. And on top of that, all the diet with low carb, low fat, with whole program, you start working, you start seeing those blood sugar coming down. And if you can exercise, it's not that hard. I myself, actually, matter of fact, I just went to see my doctor, and it was very interesting. He said, Andrew, you know, I saw you so many years, but you truly start doing things when I start telling you your A1C is almost close to 5. A1C almost close to 6.9. One more point, I will give you a medication. I will declare you diabetes. I got scared. And he saw me, first of all, start putting my diet control and so forth, and my blood sugar start going down, and my A1C becomes 6. And one more thing, she also saw and said, hey, you know, your weight going down was so good, because 4 years ago, my weight was 225 pounds. And you know what? Now I'm 188 pounds. Now, certainly it took a long time to do that. Almost like once a month, I have less than 1 pound to be losing, you know. And she was saying that give you a guidance from now on. If you can able to lose 2 kg, which is 4 pounds practically, you'll be actually a well-managed losing weight. And actually, that's what I'm trying to do. I cannot lose 4 pounds, but I can at least 1 pound. That's pretty cool. So it takes a long time, but guess what? I'm getting my objective because now I'm 188. Now, next step is my 185. Eventually, I will get down to 180. Then BMI will come down to somewhere in the neighborhood of 25. Well, hey, you know what? Although it took 4 years, but it works. My blood sugar now all the time are actually somewhere now 90 to 110 or so. Wow, that is really good. It helped my A1C probably around 6 or lower. Hey, that is good. And I'm doing it to help myself to become healthy. You know what? As a whole, I feel better. My knee doesn't hurt anymore because my weight. Wow, that's really good. So I give you a challenge. It works. It really got diet works, drink Lowsutea works, exercise work, and you don't need to be strenuous exercise. All you got to do is walk. And I walk. My regular phone just track how much I walk. I noticed I'm walking at least 10,000 steps per day, and really helped me to lower my weight because of my walking. And I also walk up some hills. So that way I can able to help myself to get my strenuous thing to go up. So it does work. So do what we said, just walk. It will help. You don't need to do a lot of strenuous thing to say I have to go lift weight. Yes, it will be good. If you have the bar bearing, you get like rating, I can't go out. You can walk in the same place with a step master with a ball bearing, go up and down like that, barbell. You can do that. And that will help you to lower weight. 30 minutes, you lose 300 calories. So this is really cool. You can do that. So do the things that I just said. It does work. And I challenge everybody on the webinar today, to do that, to help you to keep yourself healthy, because your weight go down, your A1C will go down, your body will feel much lighter, you feel healthier, your blood sugar go down. Wow, isn't that wonderful? 嗱，各位朋友，我有5個 program 咧，其實真係 work 嘅，因為我自己咧係225磅4年前，但係依家咧我係已經跌到188磅，我 target 係去180磅。咁180我 BMI 去25啦。咁但係我點做咧？其實我每日行1萬步，同埋咧食嘢係有控制啦。咁我個 blood sugar 咧要去到好多時都係5啊6啊之間。哇 ，that's really work。So 變咗嚟講咧，我血糖咧亦都好多啦。我依家 A1C 係6以下或者between 6啊或者5.9啊嗰啲啦。But it's okay as long as I continue to maintain 呢個咧係好正嘅。So 其實我間時最初4年前咧係去6.9啊。So it does work if you work on it, okay? So don't give up, it will work, okay? So today we're going to talk about why pre-diabetic patient and diabetic patient has potentially developed chronic kidney disease. And the sad part of that is the chronic kidney disease usually had no sign and symptom. So you, if not really ask the doctor to check, you might never know until, wow, I have sign and symptom, but maybe at the time it's too late. Because a lot of doctors might not necessarily caught on real quick. You might have to remind them to actually ask, hey, can you check my kidney and check my test, like whatever test that we need to, and we'll talk about that later. And you can able to actually spot it early, then you can able to do something about it. Now, in the United States, kidney disease death is the 9th highest death in USA. And kidney disease can actually start damaging the kidney in a very early stage. When you're pre-diabetic, already maybe start damaging the kidney. The reason the kidney has a lot of sugar no, sorry, a lot of blood vessels, tiny little blood vessels in the kidney. And with high sugar, it starts damaging those blood vessels. And eventually you will start getting early stages of chronic kidney disease. So although the kidney disease is actually silent, you don't know because there are no signs symptoms. But if you can do early testing, as I mentioned, we'll talk about what tests you take, then you can able to actually see that, oh, wow, I really, my kidney only got 60%. I better start doing something about it. So today, we will give you all the tips how to prevent that. And hopefully you'll catch it early so you will not end up with a serious chronic kidney disease. You might start out with it, but at least you don't get progressed. Just like my patient, she only has 40% of kidney function, but rest of her life, she still stay at 40. So she's very grateful to what we talk about, and she now prevented from getting worse. And that is the key. 各位朋友，其實咧好多人唔知道咧腎功能咧，如果衰咗咧係好弊嘅，因為會好多問題出現。咁但係其實最慘咧就係呢個腎病咧係你唔知喎 ，until 好嚴重你先發現，哇，原來有腎病啦。咁所以咧，其實咧喺美國咧最多人死係即係喺死亡率咧喺9個最高嘅死亡率係 kidney disease 係腎病。所以其實咧好多人都原來死嘅時候知道，哇！我有腎病啦，冇得醫啦，冇好慘喎，係咪？咁其實咧，點解咁咧？就算係前期患者都會能夠損壞個腎咧，就係因為嗰啲糖咧塞住晒啲微絲管咧，就開始 damage 個腎。咁開始 damage 個腎咧，一 damage 咗個腎咧就唔會翻轉頭喎，一路 damage 一路整個腎會越整越壞啦。咁所以 end up 咧，你個腎咧就已經 permanent 壞咗啦。咁所以變咗今個 lesson 咧，就希望我哋早啲俾啲 idea 你去點處理呢樣嘢個腎嘅保護個腎啦。第二樣嘢，如果你前期患病或者你已經糖尿病者，俾 tips 你問翻醫生，醫生，我想了解個腎係好唔好咧？你可唔可以用啲咁嘅 test 啊？咁最低限度咧，好多時醫生未必做啊，但係你問咗佢，佢會做咧。咁你呢啲了解，哇，你腎係咁㗎 ，OK？ 其實我都有幾個堂友聽咗我哋書之後咧，問咗醫生咧，就開始 check 咧。咁佢哋都了解個腎原來得翻50%，或者有啲朋友咧係得翻40%，所以變咗嚟講咧係一個好重要嘅東西。咁今次咧就會有好多 tips 係幫助你更加了解呢個問題嘅。So important on this lecture will give you the idea, so you can able to start understanding it, and so net result you able to actually have better control your disease of chronic kidney disease, so you don't get worse. Now, let's talk about kidney. Now, kidney is a very vital organ. And you might say, well, kidney, I just make urine. Well, it's not quite true. Kidney, if it doesn't work, you are actually will have so many serious health issues. Come on, let me share with you what kidney will do. Kidney not only make urine, but also remove all the waste, extra fluid from the body, remove acid made from the cells or the waste that comes up, keep the blood balance in water, salt, mineral like the sodium, calcium. It dumped out the excess sodium, excess calcium, potassium, the phosphate. All those things are very important, managed by the kidney. And also keep your bone healthy. Now, if you don't have this hormone from the kidney, your blood pressure is also be super high, because what happened is they have one hormone is so important, it come from kidney to control your blood pressure. So kidney is a very important organ. That's why they have two. If one got bad, and you have a backup. I think God is very smart, give you two kidney, so in case one got worse, the other will take over. So net result, kidney is a very important organ. Don't think that kidney, wow, it's not that important. It's an important organ you must have, because if not, a lot of serious problems. And if the kidney don't work, then you have to dialyze. All the things I talk about is going to be additional managed to you. So imagine if you do that, the cost of medication, the cost of the dialysis, the health that you will be engaged to manage will be so complicated. So don't want to go in that boat, because I took care of a lot of dialysis patients. It is a mess. Every time I took care of them, it is so difficult. So I think that is the kind of issue you don't want to get on, okay? Now, 腎咧係一個好重要嘅器官嚟嘅。點解咧？如果個腎冇咗之後咧，你會有好多嚴重嘅健康問題會出現嘅。For example 啦，好多人以為哇腎好簡單啫，係咪淨你整尿出嚟嘅咋？唔係咁簡單。仲有咧，佢係幫助你排泄好多冇用嘅身體嘅雜物或者係多餘嘅液體，全部佢掉出嚟嘅。同埋咧，仲有細胞產生酸性，又係佢度掉出嚟嘅。仲有一個好重要咧，就係佢將所有嘅水啊、鹽啊，同埋依礦物質啊，好似鹽啊、鈣啊、鉀啊呢啲嘅東西咧，全部將佢好 balance， 就係喺個控制咧，喺個腎嗰度控制出嚟嘅。仲有咧，如果你骨骼嘅健康咧，亦都嗰度控制出嚟嘅。有一個重要，更加重要啦，就係你血壓啊，因為咧佢個腎咧係有一個荷蒙咧，係幫助你 control 呢個血壓。冇咗佢之後咧，你弊家伙啦，你就個血壓就好難 control 嘅。所以我 take care 腎病未間食嘅 take care 腎病係好煩嘅。個原因咧就係佢太多嘢一路冇出嚟咧，咁令到咧你要諗好多嘢啦，個醫生亦都要諗好多嘢啦。能夠控制個病人，所以個病人咧係會好sick啦，身體樣子又唔靚仔啦，食嘢又唔靚仔啦，又好 weak 啦，工作又做唔到啦，哇！真係好陰功啊！所以變咗我都唔希望我哋任何病人 go into the stage. So I really do not want to see any of us here get into the stage of end up the kidney fail, end up dialysis, because I saw so many patients. In Hawaii, when I was working as ICU nurse, in Asia Pacific, when I worked with dialysis, CAPD, many of these patients are suffering. Their face color look terrible, the skin is terrible, they're weak, they cannot work, they're totally, really, really suffering. So don't get into this boat. The sad part is though, if you have diabetes, 1 out of 3 of the diabetic will have some kind of chronic kidney disease, CKD. Now, the reason why I want you to understand chronic kidney disease usually called CKD are something that you got to remember, because a lot of people just call CKD. And also, you might want to also think about this term, the diabetic nephropathy. And basically, you heard about this term. You need to be careful. Now, how the kidney work is basically, I just take a part of this kidney, and basically this inside kidney is nephron, and inside have a lot of microvessels. And what they do is on this thing here, all these vessels, they will dump out the protein or whatever, the waste, they come out through urine. And that's what your waste come out, and the protein potential might be come out. And there's this filter process, millions of vessels. That's how it works. So that's why it's so important when the vessel blood go inside and then eventually urine comes out, we'll take care of all the waste. So it's a very simple way to describe what the kidney does, right? Just now I talk about they take care of all the waste to come out, the urine comes out. So basically, this picture will give you just a very glimpse and a very easy understand what the kidney does. 嗱，各位同學，重要點咧就係每3個糖尿病者裏邊咧，可能有1個人咧已經係一個慢性嘅腎病者嚟嘅。嗱，當然啦，好多人慢性糖尿開始咗，但係佢未必係去到好嚴重。但係已經開始咗嘅時候咧，你就要處理。唔處理咧， 10年後咧，你可能得返40%。如果再差啲30%，唔好意思啊，你要洗腎。哇，唔好去呢條路啊 ！It's not good for you， 真係唔好去，因為我睇過太多病人係去呢條路咧，就會好弊啦。所以其實好重要咧，一知道你有 CKD 咧，真係要保護個腎。係點去保護個腎咧？就係 control 你嘅 blood sugar 啦。依家會再講多啲嘅，但係重要咧就係要保護個腎。OK， 咁其實咧有幾個字咧，可能你要做慢性疾病腎病咧係好重要嘅。糖尿病嘅腎病，咁呢個嘅 CKD 咧呢個字咧，可能你會喺醫生係聽過啦。咁你要真係要多啲了解呢樣嘢。嗱。The important thing is a lot of patients, when they have pre-diabetic or diabetic, they tend to have very much as always have two signs comes out. Potential, the risk of CKD will be high blood pressure, because high blood pressure, you know what? Continue to damage the kidney. And then the blood sugar goes up, also continue to damage the kidney. So two major signs is a prerequisite of this is high blood pressure, high blood sugar. Now, let me share with you, yesterday, I actually talked to, I didn't talk to the doctor, but I talked to the patient. I was in a clinic, seeing my doctor, just basic review. But I saw a patient, when he measured the blood pressure was 180. And the nurse said, hey, is your blood pressure always high? The patient said, yeah, it's always 180. And the nurse said, do you actually take medication? He said, no, I didn't take the medication. And I said, wow. And I talked to the patient, just on the side, he was sitting next to me. I said, is it always you do 180? He said, yeah, I've been, a couple of years, I 180, we're not able to control it. Then I said, wow, you better ask the doctor to control blood pressure. Because at the end of the day, if you have 3-4 years of 180 blood pressure, you will definitely have damage to your kidney, and eventually you also have a high risk of what? Stroke, heart attack, all that will come. So you don't want to have continued high blood pressure or high blood sugar extend a long period of time, because all that will basically damage kidney and make your kidney will be not functioning well. So keep that in mind. That will be 2 very important early signs. 嗱，各位前期患病嘅糖友或者糖友，記住高血壓咧係一個好大嘅問題嘅，因為佢高血壓咧係 damage 你個去損壞你個腎嘅裏邊嗰啲微絲血管啊。high 糖即係高糖。又係一樣嘅嘢，係損壞你微絲血管嘅。咁兩個嘢咧，如果你有高血壓、高糖咧，咁嗰個 risk 嘅風險咧，係會幫助你咧係增加好高咧，係繼續去損壞你個腎。所以呢樣嘢咧，因為腎嘅血管係好多，當然係啦。但係當你1-2年、3年，呢個血壓高同埋呢個糖尿高嘅話咧，咁個腎咧就一路咁損壞，咁你嗰個腎咧功能一路降低咧 ，eventually 你就要洗腎啦。所以千祈，如果你血壓上高嘅話，你喺度話俾醫生，喂，唔該你幫我手去搞血壓咧 under 130，高血壓減到130。我糖高，唔該你 A1C 由10俾我降到6點幾、6.4以下，呢樣嘢要 after doctor 幫住你搞啦 ，OK？So very important, if you see yourself, your blood sugar go up to as high as 180, for example, you better ask the doctor to help you bring it down to 120. And if your blood pressure is 180, you better ask the doctor to help you bring it down to 120, because both will continue to damage your kidney. Is not going to give you a very good result as you move on. Now, a lot of time when you have diabetic and with a kidney disease, you also definitely have other health issues will come by. For example, if your kidney getting bad or start getting damaged, mostly associated with Your heart will be issue because I just mentioned earlier, you have high blood pressure, high blood sugar. Most likely your heart will be involved. And also a lot of people have family history. If you have, relatives, your father, your brother, your uncle who have kidney failure, so you better watch because most likely you might have that link to get kidney failure also. Now, also when you have high problem with your kidney disease, most likely you also have diabetic nerve damage because of the fact that most likely you're diabetic, nervous damage, and on top of that, you also might have vision damage because of diabetes issue. A lot of these people might be also overweight. When I was in Hawaii as an ICU nurse, I saw a lot of my diabetic patients are all overweight, and they are definitely 300 pounds. I tell you, dialysis at 300 pounds is very difficult, okay? Because there's so much more waste have to come out, right? And on top of that, they have high blood pressure. I see their blood pressure is way out of the scale, 180, 190. And I always worry this guy eventually gets stroke or heart attack. And the blood sugars are always out of control. On top of that, I found a lot of these patients of mine also enjoy very salty diet. They eat really salty food, fried rice and all the good stuff. Yeah, but in a sense that you put a lot of salt in there, salt, when they eat, they go bang, 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 salt, not pepper. And so that result with the salt, they also drive out the blood pressure. So if you're Asian American, African American, Native American, a lot of our Chinese also have the issue because they not eating very light salt diet. They eat a lot of very salty diet, a lot of soy sauce. All that will cause you major issue. So if you are potentially you're diabetic and most likely you already have some kidney disease, the other associated disease come by will be all I just mentioned. So be alert to it, okay? 嗱，各位朋友，如果你啲糖尿病或者你啲前期患病咧 ，most likely 咧，你個腎咧開始有損壞啦。但係當你腎損壞之中咧，你可能有好多其他嘅病咧，都加埋一齊出嚟嘅。心臟病啦，因為你腎唔係咁 work 嘅時候 ，most likely 有血壓高、糖尿高，同埋如果你屋企人有個腎病咧 ，most likely 咧都有個 high chance 你有腎病嘅喎。同埋仲有咧，你會個神經嘅損壞啦，因為你diabetic啊嘛。同埋仲有咧，你仲有個眼嘅損壞啦，呢啲亦都有好問題啦，因為你diabetic。同埋好多呢啲人咧，多數係重磅嘅，即係話 BMI over 30，哇大隻！我近成日話嗰啲人咧，個個都有200、300磅，哇好勁啊！咁啊洗洗就好難洗嘅，因為佢好多問題出現。咁個高血壓同埋高糖又係兩個大問題嘅，仲有好大問題咧，好多啲人咧好中意食鹹嘢嘅，佢哋咧成日都俾啲鹽咧打落去咁，唔係食胡椒粉啊，加鹽，因為佢覺得冇乜味啊，要加鹽又有加豉油，中國人都有好大問題嘅，因為佢加豉油咁一樣嘅啫。咁所以如果其實喺美國咧，啲人咧係亞洲人啦，或者係黑人啦，呢啲人咧係好多有呢個問題出現嘅，因為佢嘅 diet 係咁啦。咁其實中國人都係嘅，因為佢好多人食豉油啦，咁因為佢覺得唔夠味啊，要飽嘅時候，咁呢個係全部有一個問題，所以一定要睇翻咧。如果你係已經有糖尿病，又已經有先兆之類有些少嘅腎病嘅話咧，你要注意其他東西啦，因為呢個亦都會一路咁影響你嘅。嗱 ，the sad part is this is really a silent disease. And that's why I think last time Larry Chan was talking about when you have this problem occur, most likely when your kidney get down to only 75% lost, in other words, you no longer function. The symptom, if you get 25% of symptom of 25% of kidney function, then the symptom will start coming up. Wow, imagine that. That's too late. In other words, you get 25, that means you need to now pretty much get a start dialysis. Then your symptom shows up. That's too late. So that's why I said this is a true, very sad, silent disease. We better hook it up early, not to, get alert early, not to get yourself, maintain only get you 25% of lost 75% of kidney function. Then you start doing something about it, it's too late. But at least you know when that happened, most likely you lost appetite, you have trouble sleeping, you're getting very fatigued, very tired very easily, you got a weak, you get nausea, non-vomiting, you itch everywhere. You notice dialysis patients, the skins are dark color, and they have itch. Their skins are all dry and itchy. Their muscle cramp. They're swelling their feet and ankle. The ankles are really sort of. They're anemia, they also cannot do much because they're shortness of breath. They might have chest pain. The blood pressure usually high. The blood sugar also high. So, if you get this kind of symptom, most likely it is kind of too late. So I hope all of us listen today, don't get into this stage before act. Act before you get to 75% your kidney lost and act. It's too late. Don't do that. Okay? 嗱，各位同學，今日講座咧，真係我希望大家咧了解到咧，因為呢啲咁嘅腎病嘅病人咧，如果你得返25% 嘅腎功能，即係話 lost 咗75% 嘅腎功能咧，你個開始跡象會出嚟嘅。咩跡象啊？冇胃口啦，瞓唔到覺啦，好攰啦，成日疲勞成日好疲勞啦，仲有好弱啦個人，又會作嘔啊、屙肚啊，個身體成日好痕啊，你見到腎病嘅病人裏面係全部黑咪掹嘅，好多時。咁同埋仲有咧有抽筋啦，個 ankle 又腫啦，即係腳會眼腫啦，同埋咧個腳又腫啦，同埋咧仲有唞氣又唞唔到啦，有心臟又痛啦。就血壓又高啦，血糖又高啦，呢啲嘢全部都係有咁嘅問題出現咧。但係嗰陣時咧，你腎咧得返25%功能，咁變咗嚟講咧，你已經係準備已經係要洗腎㗎。咁所以變咗嚟講咧，喺呢個 stage 裏邊咧，做唔到其他嘢嘅，即係你唔會係令到你更加 improve 嘅，你係會越整越差。所以希望咧，你永遠唔喺呢度，永遠你係已經希望已經聽完書之後咧。你係準備咗自己咧，係控制你嘅糖，控制你血壓，你唔會踏入呢個情況，所以希望做到一樣嘢。So you might ask, gee, if I don't want to be in that stage of, 75% of my kidney function are lost, so what should I do to check I'm prevention? And that's what I really hope everybody do this from now on. Now, if you're diabetic, pre-diabetic, you really need to check at least once a year to understand what is your kidney function. Are you in kidney disease, or are you long-term kidney disease, or any issue with kidney disease? So how do you check? The first check you check is the urine check for protein dumping. So see how much your microprotein is actually come out from the kidney. If you're over 300 milligrams, it's really dumping out. It really mean that there's a sign of kidney damage occurring. So 300 milligrams is actually one of the signs that you already start knowing. Now, you less than 30 grams, you are perfectly normal. But 30 to 300, you already start getting early sign of kidney disease. So you got to be careful, 30 to 300. So the doctor will start measuring you, and you're going to start taking every 6 months. At first, you might get 30, after 100, and so forth, so forth. So you got to really understand what stage are you at, okay? And then one of the very important things besides your urine measure and albumin coming out, you also got to measure your glomerular filtration rate. The common term is called GFR, which is a blood test. If your blood test of GFR is 60 or higher, you're normal. But if you're over under 60 and moving toward to 30, you are in trouble. because 30 is the time that is the marker of saying you might need dialysis. If you're 15, guess what? You already pretty much have lost most of the kidney function. You need dialysis. So GFR lower, under 15 and more, you actually need dialysis. Plus, you have to measure your A1C. Your A1C has to be seeing your A1C should be lower than, hopefully, you're lower than 6.4. You are pre-diabetic. Continue to measure yourself. Get your A1C to below 6 will be even better. Up to 5.7 is great. If you're diabetic already, try to drive it down to 6.4 and below. Plus, your blood sugar goal should always 80 to 130 or 4.4 to 7.2 millimole per liter for Hong Kong and Saudi Asia, but in the United States, 80 to 130 milligram per deal. So you always have good blood sugar level. That would be really good. And 2 hours after lunch or after dinner or after meal, you should be under 180 milligram per deal or 10 millimole per liter. So you gotta have all those targets for you to continue to make sure you are decreasing the risk, your blood sugar, and also your blood pressure has to be also monitored. Hopefully your blood pressure under 130 over 80. You gotta continue to do that. So all that will help you to lower the chance to getting chronic kidney disease. 嗱，各位糖友同埋前期患病嘅朋友，好重要咧，有幾個 test。第一個就係個尿嘅 test， 係幫助你 check 每年都 check， 睇下你係咪有呢個腎病嘅問題啦。第一個 check 咧就係叫做 microalbumin test。咁如果一個albumin 咧係一個蛋白質啊，掉咗出嚟咧，如果呢個尿道嘅蛋白質係掉咗出嚟。但係呢個蛋白質咧，你掉出嚟嘅時候咧，你得返30個 milligram 咧，咁呢個係 normal 嘅。但係如果你由30至到300咧，咁你就要開始注意啦。過咗300咧，咁你就一定有一個係情況嘅出現咧，超過咗300，你一定係你個腎係唔正常。咁你就係有機會咧係見咗係一個前期患病長期嘅腎病者啦，患病者啦。咁呢個第一個。尿 ，OK。第二個係個驗血，驗血裏邊咧有個 GFR， 咁呢個主要係腎小球個過濾係點能夠幾多過濾咗出嚟咧？咁如果 GFR 係60以上咧，咁你係正常嘅，但係60以下咧，你要開始注意。如果你30咧，你就差唔多要洗腎，但係如果你去到15咧，即係話你一定要洗腎啦。所以其實呢啲咧係好重要咧，你係要知道呢啲咁嘅情況。嗱，好多時咧，去政府醫生或者私家醫生，佢未必同你做 GFR， 亦都未必做個尿嘅測試，可能要問佢提佢，喂，我係糖尿病者，你可唔可以每年 check 我呢樣嘢啊？嗱，好嘅醫生係多數會 check 嘅，但係未必個個會嘅，所以有時唔記得咗你提嘅醫生咧，佢就會同你 check， 咁啊幾好啊！最緊要我知道我腎個功能去邊度啦，係咪？同埋咧，仲有一樣嘢咧，要 check 個血糖嘅 A1C。你嘅 A1C 咧係應該 under 6.4以下，最好去到5.7啦。但係好啦，你係糖尿病者未必做到呢樣嘢。咁仲有一樣咧，篤手指咧嘅時候咧，你食飯啊嗰啲時間咧，最好你個 A1C 如果空肚嘅時候就應該80至130，或者4.4至到7.2。呢個 range 咧，你啊繼續係你個 target 嚟嘅。食完飯咧，你係 under 10，要食完飯 under 10。喺美國就係180啦，喺2個鐘頭食完飯之後。咁呢兩個血糖嘅指數咧，你個高咧，你個即係目標咧，就一定係呢個希望 achieve。So importantly, keep that in mind. The test will be urine test. Is one thing, microalbumin. Second, you gotta test your GFR. 3, you have to test your A1C, make sure it's lower than 6.4. Below is better. And plus, you pick your finger. I have to understand that my blood sugar before eat, is it over 130, or it will be like 4.4 to 77.2. After dinner, 2 hours, my blood sugar is 10 millimole per liter or under 180 milligram per dil. So those are the target you need to look for. So important, a lot of times you have to remind the doctor to make sure you do the test, because a lot of doctors might not do the GFR, or they might just forgot. So you might need to talk to the doctor and say, Doc, can you check my kidney and see it works, so I can have my GFR blood test? And also I want to check my microalbumin protein, see whether I'm dumping protein. So they will check, just give you a baseline, okay? Now, because all of us might be diabetes, we have to also check our current diabetic treatment. How are we doing? Is our medication work? Also, another thing we have to ask ourselves, are we also controlling our carb intake? Are we eating healthy? Are we active enough to walk around, move around, make sure I have enough exercise? Is my blood sugar level, picking my finger, is really giving me a result? Importantly, is also a lot of time you should get your Abbott Libby, because I found that it's so convenient. Especially I can say, after breakfast, I know how I'm doing. I 5.2 today, you know, I 5.2. At least I know this is where I'm at. And that is about 100 or so. And so at least I know my blood sugar is really going down, doing a good job. And that's why I ask most of my customers, if you have a chance to get Abbott Libby, do it, because you have to painlessly always measure blood sugar without you doing so much, and no pain. And so that will be important. Plus, they give you the average blood sugar on top of your A1C will be very good. So always try to measure blood sugar. 嗱，各位堂友，好重要咧，你要知道你現在嘅糖尿病嘅藥係咪可能夠真係降低咗你血糖咧？同埋你有冇做任何嘢，好似你嘅 diet 啊、食嘅嘢啊，你碳水化合物夠唔夠咧？同埋你係咪夠 exercise 咧？可以能夠令到你血糖降低咧？好重要咧，要繼續 check 你嘅糖。一係篤手指，一係咧就買個 Abbott Libby 無痛嘅去 check。其實呢個好重要。點解你成日食完嘢之後，或者你係未食嘢之前，你都度一度知你原來哇血糖 OK 喎，或者我血糖唔 OK 喎。咁唔 OK 嘅話，你就要控制啦。所以 so important， you have to continue to measure。有啲話我冇 Abbott Libby， 唔緊要，篤手指啦，篤手指好容易嘅啫。咁你就可能就知道你個血糖係幾多，又準確又容易睇到。Now, if you are constantly, your blood pressure high, like 220 or 180, like my patient friends that sat next to me, a few years of 180. Oh my goodness. I said, did the doctor know? He said the doctor didn't know, but not really doing anything. I said, well, you better press him to say, give me more medication to lower my blood pressure. Because if not, any higher blood pressure few years, your kidney can be damaged. And that will lead you to have the CKD, chronic kidney disease. Then next thing you know, you might potential heart attack, stroke. Wow, that's terrible. All these things totally get you to be very poor health. And on top of that, expensive, and you're not able to enjoy any of your family. And I don't want you to go into this road, man. It's not good. You gotta try to get your blood pressure on. And for us getting older, your blood pressure should be not over 140 over 90. It should be 130 over 80. Okay? And that's your target, 130 over 80. And on top of that, and this is on resting, by the way, you're not while you're doing strength exercise and measure, it's not going to work. So when you rest of 15, 20 minutes, your blood pressure should be 130 over 80. Go long drugstore or go to pharmacy, buy a blood pressure cuff to measure yourself. That will be really good, because then you can able to understand where you're at. And you're going to ask doctor to give medication to lower your blood pressure. Now, one more thing that I noticed, a lot of elderly patients might forget to take blood pressure pills, and that is detrimental. The reason why I say that, one of my very dear friend, mother, forgot to take a blood pressure pill for almost 10 days. The end of 10 days, you know what happened? Stroke. Blood pressure went up to over 300. And lucky, she had a stroke, but day after, she had tremendous, disability for next 5 years of her life. Cannot walk. I mean, it took a long time to recover, but still really not working. Said cannot walk, you have to be taken care of, someone have to take care of you. Man, it's not a good stage, okay? So keep that in mind. Always control your blood pressure. 嗱，各位朋友，如果你係高血壓嘅，就 chance 你損壞個 kidney 咧係好高嘅，你腎整壞 kidney 好高嘅。咁其實你一定要控制呢個血壓高嘅問題，去 prevent 呢個 CKD。咁點控制啊？如果你依家血壓已經係sorry， 如果你血壓咧係唔應該高過140嗰個90嘅，你應該係喺130至180嗰度坐20分鐘先去度咧。咁你血壓咧係應該大130、180 ，always say嘅。千祈唔好喺計劃180 OK， 唔 OK，180係唔 OK 嘅。咁同埋如果你血壓高咧 ，make sure tell 個 doctor， 話醫生，醫生唔可以俾我血壓降低啲得唔得？去到140以下得唔得？醫生就會希望佢做到呢樣嘢嘅。同埋有一樣嘢，好多老人家係唔記得食藥。我個好朋友個媽咪咧，最弊咧佢就10日唔記得食藥，咁點啊？爆血管，血壓就去到300度。咁但係300度裏邊咧個問題，爆血管之後咧，佢仲要瞓喺個床嗰度去5年之後先死喎。咁嗰5年係幾受苦啊？要俾人 take care 啦，行唔到啦，做唔到啊，手又唔喐啦，哇！真係好慘，5年唔喐，受苦，講嘢講唔到，哇！幾慘啊 ！So do not go into that. So always take care of blood pressure. That's not a good thing to have. 嗱，好重要咧，you have to eat healthy to manage 個 diabetic， 因為咧嗰糖尿病咧係幫助你咧係損壞你成身血管嘅。咁你 blood sugar 繼續高咧，就會一定 damage 你個 kidney 啦。咁所以變咗嚟講咧 ，everyday 食任何啲食物啊，要降糖啊，就要降低碳水化合物。咁你 cholesterol 高又係唔得嘅，咁唔好愛呢啲高 cholesterol 嘅食物啦 ，olive oil 啊，同埋 blood pressure 咧，就你唔可以食個2300個 milligram 嘅鹽，因為糖咧鹽高 up 咧 ，guess what 就會整高你血壓嘅。咁所以呢啲嘢係一定嘅 manage 嘅。咁你當然食多菜啊，同埋生果啦。So very important. Eating healthy diet is so important for managing diabetic and also prevent you from chronic kidney disease, CKD. Prevent that happening. So important is always measure blood sugar level, control the blood sugar level by not eating all the carbs that have high, carbs, so spike your sugar. You should actually eat about the same amount of type of food a day that make it easier for you to manage your blood sugar. You have to control your cholesterol. So your cholesterol, instead of eating a lot of butter, fat oil, lard, you gotta use like olive oil. So that result, you cut down the fat. Your blood pressure, don't eat too much salt. The salt will be 2,300 milligrams of salt a day. That's it. Don't add on additional salt because when you add additional salt, it's just jack up your blood pressure. Like canned soup, lunch meat, spam especially, fast food, eliminate that. And on top of that, you want to eat less like French fry, all the good stuff that you thought that McDonald's is good, and it's not good for you. You got to eat more herbs, spice, less salt. And on top of that, you got to eat more fruits and vegetables. So net result, it'll lower your basically blood sugar, cholesterol, and blood pressure. And again, we have to stay active. You have to keep up a physical activity every day, move. Like me, I go 10,000 steps. And then you have to keep walking. Like in Hong Kong, you can walk shopping mall, you can go dance, mountain climbing you want to. But the worst thing you do is just sit there, watch TV every day, and you don't move at all. Now, you want to watch TV, it's okay. I go a step master. I watch a lot. Sometimes in Hong Kong, really raining hard. You know what? At home, I do my step master. I have two barbell, and I go up and down. I do half an hour to 40 minutes. I still did my exercise. But I'm watching TV. I'm watching CNN. But that works. I still lose, 300 to 400 calories. Plus, I did my step master. So stay active. That's what you got to do. And with that, you can actually burn off sugar. You can also get yourself lower cholesterol and lower your calories. So that's really cool. So always stay active. 嗱，保持 always 有健康嘅運動，因為如果唔係咁做咧，你嘅血糖唔會降低嘅，你血壓亦都唔會降低嘅。所以咧，你一定要點啊行啦，香港最好行 shopping mall 啦，食完飯你行咧就降低晒啲血糖，因為你行啊嘛。你要出去跳舞都 OK 㗎，有啲行山就 OK 嘅。就 worst thing 咧就唔好坐喺度睇電視，唔喐睇電視咧，你會肥胖啦，食完飯。咁最好咧就係睇電視嘅時候咧，都做啲運動啦。點做啊？行，坐喺度行啦，或者揾兩個啞鈴啊，去喐下喐下。咁你如果你40分鐘咧，你 burn up 大概300至400個卡路里㗎啦。同埋咧，你亦都能夠將你嘅血糖會降低，亦都將血壓降低。So important to keep yourself active, stay active, and so net result, you will continue to be much better, health in that sense. Now, also, you got to stay hydrated. The reason is if you stay hydrated, your blood becomes thinner, and that result of that, you also help you to good hydration. You have enough water to do your toxin, throw it out, and actually you can able to start getting detox. How do you do that? You drink 2 liters of Lowsutea per day, and with good hydration, you're able to clean your body with all the sodium dumped out, the urea comes out, the toxin come out, and then plus Lowsutea also will help you to lower your blood sugar, the bad cholesterol, sodium, and that result, your blood pressure goes down and your detox. So isn't that wonderful? And that's what you're going to do. 好重要咧，就係每日咧飲2公升嘅去糖茶。點解咧？因為你有水分先能夠帶到啲垃圾走啊。咁你唔帶啲垃圾走咧，你唔做呢樣嘢咧，係冇嘢俾你帶咗出去喎。所以飲咗去糖茶咧，你血咧亦都係大擼咗佢啦，你血糖唔會高啦。第二，Lowsutea幫你將血糖掉走啦，你 cholesterol 掉走啦，你鹽掉咗啦，同埋你嘅 detox 咗之後咧，你又會令到你血壓會上升啦。同埋仲有你血糖會上高，咁係好事嚟嘅，真係一定要飲去糖茶，每日飲2公升咧，係會對你十分幫助嘅。So very important, you gotta continue drinking Lowsutea at least 2 liters per day. That will help you out. Now, one more thing is very important in typical diabetic patient. You really have to manage your stress because stress increases blood sugar. Because the body will react to it and say, wow, I'm stressed. So I have to really, really quickly to get more sugar from everywhere in the body ready for me to go to war, right? So if you continue to stress, it will be difficult to manage your blood sugar and your blood pressure. When you stress, guess what? Your blood pressure also goes up. It's not only blood sugar. So physical activity will definitely help you to lower your stress. And also, if you continue do activity, maybe even depression, you manage well. And you got to relax every day with some quiet time, breathing exercise, muscle relaxation, read a book, spend time with your pet. Pet is really important because you have pet him, you feel much more comfortable, you're much more relaxed. It might help you to decrease the depression. Talk to your pet. And my friend has said, when I feel sad, I talk to my pet. You can do that too, because pet is a good companion. Work with them, and they will love you. You pet them, you feel good. Why not? Also, talk to your friends, relatives, share happiness and your problem. Because more you talk to them, more you open up your feeling. You feel much better. Rather than hide all inside. Oh, I feel sad, man. I don't feel good. If all that you've done, it didn't help you, then you might actually need some outside help. Maybe professional help, to seek some help to help you to lower your stress, lower depression, and net result might help you to lower your blood sugar and pressure. Important, stress and make it difficult for you to manage your diabetes. 各位朋友，我哋亦都要管理咧我哋自己嘅壓力，因為壓力咧會增加你上升咩啊？糖啦、血壓兩個都上升嘅。咁其實咧有幾樣嘢係可以幫到你。第一，你個喐動嘅 physical activity 就係幫到你係 decrease 你嘅 stress 嘅，亦都幫助你咧點去 manage 你個 depression 嘅。當然啦，好多人咧點去 relax 咧有好多不同嘅方式，可能有啲人讀下書啊、睇下電視啊、聽下好啲音樂啊、去massage 啊，或者去同你個小動物傾下偈啊 ，OK 㗎。小動物係幫助好多嘅，即係你隻狗啊或者貓啊，你摸下佢係舒服好多嘅。所以其實咧有貓狗咧，其實係幫到你係降低嘅 stress 係好重要嘅。你可以同隻貓傾下偈，狗傾下偈 OK 㗎，佢亦都好聽你講嘅嘅。所以呢個咧係好重要嘅。咁當然咧，你亦都係當你嘅親戚朋友啊傾下偈啊，講下你開心嘅嘢，亦都係講下唔開心嘅嘢啊。咁令到你能夠令到你所有啲情緒嘅問題咧能夠降低降溫，咁你個 stress 咧會降低，你個 depression 會降低， blood pressure 會降低。但係其實如果樣樣都唔 work 嘅話咧，可能咧你只係需要一啲即係 professional help 或者醫生啊，或者你個即係精神上管理嘅醫療嘅病人咧，啲醫生嘅護士啊，係要幫助你去點降壓嘅。咁呢個係一個係對成個糖尿病係一個重要嘅東西，唔好唔記得 stress 係整高你血糖，亦都整高你個血壓，兩樣都係 damage 你個腎。Okay? Okay. One more thing is you got to remember smoking is not good for you. You got to stop smoking because smoking will affect your blood flow to the kidney, increase risk of heart attack and stroke. And also smoke can slow down the flow to your entire body, the blood flow, and potentially if you smoke all these, eventually you get infected or cut in a lower extremity. It might not heal because you are smoking. So you got to stop smoking. Smoking is not good for you, actually. It affects your lung. We don't have time to talk about all the other things. Eventually lung cancer, all the good stuff. You don't want to even go into the road, right? So smoking does affect your blood flow to your kidney. So don't smoke, okay? And also increase the chance of heart attack and stroke, okay? So 如果你食煙嘅話，唔該你唔好食煙啦，因為食煙咧會影響你血液咧去你個腎嗰度嘅，亦都 increase 到你個心臟病啦，或者有 stroke 啦，同埋仲有咧希望你就唔好lower extremity 腳啦，會影響啦，所以呢個咧係會希望你唔好搞呢樣嘢啦。OK? So in summary, pre-diabetic, diabetic patient, if you want to prevent for sure any kind of future potential chronic kidney disease. Because chronic kidney disease has no sign and symptom until you get down to advanced stage. So you want to identify early and make sure that you have a checklist how to understand what is CKD so you can able to capture it and may ask the doctor to check every year. Every year the health check, so you know where your kidney function is going to be. So you're pre-diabetic, diabetic. First thing, you will always check the doctor and say, hey, can you check my urine and my dumping protein, albumin, microalbumin protein. As my blood, you have to check your blood pressure. You also at least check your GFR, so you know those are three major parameters that you know you are not hitting those levels. Second, you also need to always check is your diabetic treatment is successful. Make sure your drugs, diabetic drugs, is helping you lower the blood sugar, and plus your diet taking is actually controlling your blood sugar also. And make sure you have good sleep habit, control your blood pressure, and then you have to eat healthy, manage your diabetes, so you can able to make sure you have low carb diet, continue lower blood sugar, and you have to continue to stay active, daily exercise, movement, and also you have to continue to be hydrated. Maybe use Lowsutea to help you, give you 2 liters, so you dump out your sugar, dump out your cholesterol, dump out your salt, so net result you lower your 3 high, and net result you also detox, get rid of your waste, not damage your kidney. And plus you need to manage your stress, because stress go up, your blood pressure go up. On top of that, you also increase your blood sugar, because the body will react and say, oh, I better get you more sugar for you to go well. And on top, you have to stop smoking. So net result, you get more healthier. 各位朋友記住，因為我哋 CKD 咧係一個長遠嘅病，on top of that係冇晒先同，所以好快脆你要話俾醫生聽，喂，你有冇嚟 check 啊？每一個糖尿病或者前期患病者咧，你都要提醫生，喂，你可唔可以同我 check 個尿啦、血壓啦，同埋我嘅 GFR 係咪 OK 咧？同埋咧，仲有一樣嘢咧，我現在嘅糖尿病嘅藥係咪 OK 咧？減到個糖咧，同埋我 diet 係咪 OK 咧？我瞓覺係咪 OK 咧？同埋我依家血壓 OK 唔 OK 咧？因為血壓同糖兩個都 damage 個腎嘅。食嘅嘢我要 low carb， 同埋咧我繼續係好多 activities 能夠幫助我咧係 manage 個 diabetes， 同埋咧我仲要係飲去糖茶啦。去糖茶咧係能夠令到我夠水分去掉啲垃圾出嚟，糖出咗嚟，鹽出咗嚟，膽固醇出咗嚟，咁同埋都係排毒，咁我先能夠令到我血能夠更加係健康。咁我繼續咧係可能夠幫助我咧，可以變咗我 prevent 到唔會變咗去呢個長期嘅腎衰竭。仲有你個 stress， 你個壓力同埋血壓兩樣咧，如果你壓力上升，你血壓一定會上升，你糖亦都會上升，兩個對你唔好。如果你係食煙嘅，唔該唔好食煙啦，因為兩個都係降低你嘅糖尿嘅問題，同埋你血管喺個腎功能嘅問題，全部係會損壞呢度嘅。Okay, so I'm so happy today I was able to share my finding. I hope that the people asked me previously to say, hey, can you help me to decode Professor Larry Chan lecture, make it more simple for understand how to keep our kidney healthy. So I hope this lecture will provide you sort of a more simple layman language, make it easier for you to understand. I hope I've done this. Thank you very much for people from Los Angeles, Canada, Hawaii, Hong Kong, Singapore, Philippines, who attended our meeting. Thank you very much for them. And it was great that you guys really provided, this time for us. And there's some question from my wonderful friend, Eugene. Eugene, hi, Eugene, how are you? He says, since 1 to 3 diabetic has CKD, how CKD measured? related. When do you determine when you have CKD? Okay, now that's a very good question, by the way, Eugene, because when you have 60, when you talk to the doctor, for example, one of the good things you always will measure is bone marrow GFR. A lot of, unfortunately, a lot of doctors might not necessarily measure GFR. So if your GFR is already lower than 60, then you already started an early sign of potential CKD. 60 to 30 is the gap where you can actually see where how says how serious your CKD is. So importantly, besides the albumin test, you need another test is even more important is the GFR. So that will relate it to what GFR stage you're in. Later on, I might start giving a lecture on stage 1, stage 3, and stage 4. So make sure you even understand further, but I will get a later stage, but I'll give you the simple stage first. So the 咁各位朋友，阿宇專問咗個 question 咧，佢話如果你係已經好多糖尿病，一個3個之中有一個已經係有 CKD 嘅，咁點知係 CKD 咧？如果你做個 GFR 係60以下咧，即係話50幾，即係低過60咧，咁其實你開始有個 GFR 嘅問題啦。咁但係呢個 GFR 問題咧，好多人咧就係有好多一路上去一路差落去嘅，即係由60去到30咧，呢個 range 咧就係你嘅問題出現嘅東西。即係開始有個即係點去 severe 啦，越少 number 咧，你個嚴重性越高嘅，所以咧你係要提個醫生係同你驗血做 GFR。咁所以咧好多人咧就都開始嘅時候已經知道，哇！我已經係60㗎啦，或者係59已經開始注重，咁你開始去 determine 呢樣嘢係點去控制呢樣嘢啦。OK。The second question, you think you have 2 kidney. Does the test determine individual kidney function separately? And okay, actually, when you have kidney function, they measure the GFR. They cannot determine which kidney is getting worse until you actually put more tests on, like determine on ultrasound and so forth to show is your kidney really function. So, but on the other hand, in general term, you basically in early stage, you really don't know until when you get a serious stage to give more tests on ultrasound, on the function of the kidney size and so forth to measure which is more damaged than the other. 嗱，兩個 kidney 咧，當然咧兩個都係咁上下功能嘅，但係一個壞咧，你就唔係淨係 GFR 睇到啦，要其他個 test 睇到啦，譬如好似 ultrasound 啊、MRI 啊啲會睇落去嘅，咁你先可以知道。OK。What happened? You have a lot of bubble in your urine related to microcreatinine. Yeah, if you have a lot of bubble in your urine, that's also one of the early signs potentially, because bubble might not necessarily is the protein coming up, but you have all the time a little bubble, then you should check what is the urine, microalbumin to see whether it is truly the microalbumin is dumping albumin coming out. So you need to check, okay? So these are kind of symptoms that, yes, you got to check, but not 1 or 2 times bubbles urine might not necessarily the case, but all the time, that's where you have to not need to check. And you have to check how is your urine microalbumin situation, okay? So I hope I answered all your questions. Eugene, you always ask good questions. Those are very, very good questions. 如果你尿道嗰度咧好多泡嘅，嗱1、2次泡唔緊要，但係成日都好多泡咧，咁你真係要 check 翻醫生咧，我 microalbumin 係好勁啊， 係咪彈咗好多嘢出嚟啊？咁呢個咧你就要睇翻啦，因為個 microbillion 咧大約30 milligram 係 normal 嘅，高過咧30至300咧，你係要開始注重。So keep that in mind when you have a lot of bubble on your urine, you need to start talking to the doctor, see your urine does actually have a lot of albumin. If you're under 30, you're okay. But you're 30 to 300, you need to start watching. And the key is they don't shut up right away and go gradual, going up higher. So you need to monitor the steps to make sure you control blood sugar and also help you control, the damaging of the kidney with lower blood sugar, lower blood pressure. 2 important things. And that result, your kidney will be well protected. Well, thank you very much for people from Hawaii, Los Angeles, Vancouver, Philippines. I greatly appreciate your time participating. I hope I answered all your questions. You are my star because you actually care yourself to actually take care and start treating yourself to prevent you get your CKD. I tell you, I treat so many patients when I was an ICU nurse in Hawaii. I don't want to see all my friends or any of my patients get into CKD and end up being dialysis. That is no good. So hopefully I will see you soon. By the way, on the week of the 28th, next week will be my last lecture for this month because 28th I will be in Hawaii seeing all my friend Eugene and Wason, all my classmates, because I'm getting my 50th school reunion. So I will see all my good friends there, and I appreciate they actually support me all these years and also listen to my lecture. I'll see you guys in just a couple weeks. So thank you very much, and keep working to lower your blood sugar, lower your blood pressure, and to be healthy. Aloha. Bye-bye.